So this is the second lecture of topic 14, infections of the human body. In this lecture we're going to be talking about infections of the respiratory system. So the respiratory system of course includes the upper respiratory system, so sinuses, ears, mouth, nose, those kind of things. And of course the lower respiratory tracts as well, which of course include the bronchia and the lungs. So if you take a look at this list here, we have quite a number of organisms. The usual suspects, once again, we have Staphylococcus. You're going to see that organism pop up again and again. Streptococcus, another important organism, and Candida, which is yeast. So some terminology for you. We can have pharyngitis, which is inflammation of the throat. We can have pneumonia, which is inflammation of the lungs. And usually when we're talking about pneumonia, we're also talking about fluid in the lungs. So let's start at the top, at the beginning. We are going to talk about strep throat. So most people will get strep throat at least a few times in their life. Streptococcus is found all over the place. It's found in saliva, skin. It's very easy to self-infect or get infected from other individuals. Sometimes it gets a chance to grow and cause infection, and it happens in the back of your throat and causes certain symptoms. We call it strep throat. So this is caused by Streptococcus pyogenes. So this is also known as our group A strep, or sometimes we say GAS or gas for group A strep. So what kind of symptoms are we talking about? Obviously a sore throat. And this sore throat is often very severe. So what do I mean by severe? I can tell you when I had strep throat, I couldn't eat anything other than ice cream. It really, really hurt. Painful swallowing, so I mentioned that. Fever is not uncommon, and sometimes swollen lymph nodes and tonsils, depending on how deep the infection is. And you can see this other note. It says white or yellow spots on the back of a bright red throat. So that's one way that people often know somebody has strep throat. Take a flashlight, look at the back of the throat, and you can see it has a pretty characteristic look. You know, with that pretty bright red at the back there. So what else can we say about strep throat? Remember, this is a streptococcus organism. Strep means chain, coccus means spheres. So these are gram-positive organisms, and they're catalase negative. Catalase positive, of course, is the staphylococcus. Streptococcus is catalase negative. These are beta hemolytic. So if you remember what beta hemolytic means, it means full hemolysis on blood agar. Streptococcus pyogenes is also an organism that is very good at infecting multiple body systems. So it can also cause impetigo, it can cause flesh-eating disease, it can cause something called scarlet fever. You can look that one up. We're not going to be talking about that in any detail in this course, unless you did it on one of your case studies. And also toxic shock syndrome. It has, I can't remember the name of the protein, it's different from the streptococcus one, or sorry, the staphylococcus one, but it can cause toxic shock syndrome as well. So I just wanted to point out some of the various virulence factors found in the streptococcus, which allows it to cause disease. So notice here it's talking about some strains have capsules, so that's a carbohydrate. That makes them more difficult to kill by immune cells. We've got this M protein. The M protein showed up in that video on the immune system, and this is what our immune system makes an immune response against, is that M protein. It recognizes the antigen there. Also has pyrogenic toxins. So what does that mean, pyrogenic? It's in the name, Streptococcus pyogenes. That means fever. Pyro, fire, right? It means fever. This can cause scarlet fever, rash, or toxic shock syndrome. Lastly, I want to point out on this slide, it's talking about the hemolysins. These are what allow the beta hemolytic, which allows it to kill and lyse blood cells on blood agar. So let's go a little deeper into the lungs. The lungs usually don't have a lot of organisms in there. They used to say it was perfectly sterile, but we're starting to learn that's not the case, but very, very few organisms. A lot of organisms that get into the lungs, though, can cause pneumonia, which is where we get an inflammation and fluids end up in the lungs. So pneumonia is usually visible quite readily on an X-ray, and can be a leading cause of death in some countries and in certain populations, particularly elderly people. Pneumonia can be quite serious and they can die from it. So what are the causes of pneumonia? The big one here, Streptococcus. This is a different Streptococcus. This is Streptococcus pneumonia, and this is the major leading cause of pneumonia, about 60% of cases. Other organisms, there's Staphylococcus there, of course. We've got Haemophilus influenza, Klebsiella, E. coli. So E. coli can get in the lungs in some cases and cause pneumonia, and there's our Pseudomonas again. So I'm just highlighting the organisms that we really talked about. We did not talk about Haemophilus or Klebsiella really at all. So let's talk about Streptococcus pneumonia. It's a Streptococcus. It's a gram-positive. It's catalase negative, just like all Streptococcus organisms. And this one is alpha hemolytic. So alpha hemolytic means partial lysis on blood agar. So this is about 60% cause of all pneumonia. Thankfully, it is usually treatable with some sort of penicillin. Sometimes there is resistance found in Streptococcus, and so often a second antibiotic will be given if it doesn't start clearing up within a few days of getting treated. The good news about Streptococcus is there are vaccines available now. These have been out for a little bit more than 10 years, I think. Initially, I remember Pneumovax 19 was out, and now we have Pneumovax 23, you can see here. So these are conjugate vaccines. Conjugate vaccines basically means we're taking macromolecules from the organism, and that's the vaccine. So we're not using whole cells. In this case, the macromolecules are carbohydrates. And so Pneumovax 23 has 23 different carbohydrates in its formulation. So what about viral pneumonia? There are many, many causes of viral pneumonia, probably 100 viruses. I can list some of them here. You can see in this list I have the only one here that we've talked about in this class is the influenza virus. There's another virus called the parainfluenza virus. There's rhinoviruses, coronaviruses. The list is huge. We could probably add the new COVID, SARS coronavirus on this list. And like I said, many, many causes. Thankfully, this is not usually the main cause of pneumonia unless, unfortunately, you are a child. Children, for some reason, get more viral pneumonias, probably just due to the fact that their immunity to these viruses is low. Remember this, penicillin will not help. Know this for sure. This is one major thing that you get from this course, is to know that penicillin cannot be used to treat viral infections. So let's talk about tuberculosis. This is a very significant bacterial infection of the respiratory system. Thankfully, most of us will not experience tuberculosis in our lifetimes, but historically it was very, very serious. And if you do get tuberculosis, it can be a very, very serious disease. Here is some information about tuberculosis. It's caused by this organism here. We've talked about it a few times, Mycobacterium tuberculosis. So this is a mycobacterium. It's acid-fast, so it requires the acid-fast stain. You can see that on the right. You can see those little bacilli. They're kind of pinkish fuchsia with the blue background. So here's something I've read a few times. I don't know the numbers exactly on this, but some people suspect there are 1 billion people infected worldwide, and may kill more than any other infectious disease, at least in developing countries. Many people have tuberculosis, and it will eventually become clinical. So you can have latent tuberculosis, which means you don't have symptoms, but maybe someday you will have symptoms. We'll talk about that shortly. So who is at risk in Canada of getting tuberculosis? Really a few populations. One is people who live in Canada's extreme north. It turns out that there are a lot of communities in Canada's north of Indigenous people, so Inuit and otherwise, and these communities will have 100 people, 300 people, 250 or whatever. They may not have a doctor, they may have a nurse, they may not have a nurse, and many of these healthcare workers had never seen tuberculosis in their lifetime and are not necessarily good at recognizing it. And so you can see this is part of a campaign to educate people in Nunavut on the symptoms of tuberculosis and encourage people to get tested. So who else is susceptible in Canada? A few other populations. We do have a tuberculosis unit in the Fort McMurray Hospital, and many of our street people in Fort McMurray are the higher, more susceptible individuals. Of course, anybody living with someone with tuberculosis or coming from a country where there's higher rates like Madagascar are also at risk. So let's talk a little bit about the disease tuberculosis. You can see here what it's talking about is how tuberculosis obviously is a lung disease. The bacilli go into the lungs and the immune system sees them. So these macrophages, they're little phagocytes, they can take them in by phagocytosis, and because of that mycolic acid, it can survive phagocytosis. It doesn't get destroyed, so it survives inside the immune cells, and that's what you're seeing here in this picture. So eventually you get a buildup of these immune cells that have taken in these little bacilli, and when they start to get built up, they actually show up on an x-ray, and you can see the name here, the term is tubercle. I think that's how you say it. So there it's forming, and so that's where the name tuberculosis comes from, these little tubercules, I'm not sure how to say it. So this picture is showing what happens. Eventually that thing might rupture, and then the person is going to become infectious. You have all these bacilli that are getting released into the lungs. The person might cough them out. This can be visible on an x-ray, these little holes, these little punctures, which is a traditional way to diagnose tuberculosis. So let's talk a little bit about the infectiousness of tuberculosis and the progression. You can see up here on the left I have someone who's getting exposed to tuberculosis, and here are some numbers. To the best of my knowledge, they are accurate. Not everyone gets infected if you're exposed to tuberculosis. It turns out that generally you have to be exposed repeatedly. So often it means you're living with a person in close proximity. It's not really the most infectious organism out there like measles. So you can see about maybe 10 to 30% people are going to get infected, and luckily the majority will not get infected. Again, if you're living with a person, it could just be a matter of time. So the infected people, a large percentage of them, this turns into latent tuberculosis, which may or may not someday get activated. You can see 90% of people fall into this category, latent, at least for a while. About 10% end up with active tuberculosis. So active tuberculosis means signs of disease, and this can be due to a number of things: the immune system, malnutrition, if people are HIV positive, those kind of things. A percentage of these people, of course, will die. Some people do recover. Some people will suffer for years from tuberculosis. Here are some numbers. Untreated, 50% die within 5 years, 25% remain sick, 24% recover. Not sure why that doesn't add up to 100, but those are the numbers I was able to find. So a little bit more about tuberculosis. We talked about it already, about how we can detect tuberculosis. One method, of course, is looking at sputum and staining the sputum using the acid-fast stain. I showed you a picture of that already a few slides previously. Another is the skin test. So this is something you have probably had done as part of going into the nursing program, is getting the tuberculin skin test, and this is looking for immune reaction against somebody who has had or has the infection. We can also look at the sputum using immunofluorescence. This seems to be where things are going, looking at sputum, because it's a lot easier of a technique to do, a lot more sensitive than the traditional acid-fast stain. We also have x-rays. This is again a pretty traditional method for looking for tuberculosis. So my mother, when she retired, she actually became a school crossing guard for a few years, and school boards get all their employees to get the tuberculosis skin test, and she came up positive. Now, it turns out my mother was actually vaccinated against tuberculosis a long time ago when she was a little girl, and so this is why she had an immune response against tuberculosis. So the next thing they did was they sent her for a chest x-ray. Nowadays, we have sensitive methods such as PCR. Remember, that's a DNA test. There's also ELISA immune test. There's another newer immune test I was just reading about recently that seems to be taking over, and I believe it's an ELISA-based test. One more up there, trained animals. Believe it or not, I was reading about somebody who had trained rats. Somebody in Africa had trained rats to actually smell people with tuberculosis. I'm not sure how that works, but apparently it works really well, and rats are much cheaper than the usual technology. And maybe there's some potential for this in the future in at least developing countries. So a little bit more about the disease. Remember, I was talking about latent tuberculosis and active tuberculosis. So I kind of want to compare these for a minute. So if you look at the symptoms of these things, latent tuberculosis, no symptoms, does not feel sick. So that's great. Unfortunately, you may eventually get active tuberculosis, which means you may eventually spread it to other people. So notice active tuberculosis, the big one here is the bad cough. We're looking at persistent cough for many weeks. This leads to, of course, all these other symptoms: pain in the chest, coughing up with blood, weakness, loss of appetite, so weight loss, and then, of course, like many diseases, some sort of chills or fever. What about transmission? People with latent tuberculosis cannot spread tuberculosis to others. They're not releasing the organisms, they're not coughing, they're not transmitting. The infection is kind of at an equilibrium with the immune system. Active tuberculosis, these people can spread using respiratory droplets. And I have read in some sources that it's believed that tuberculosis in some cases can be airborne. I don't think it's anything like measles where it's super infectious though. So what about diagnosis? You can see latent people will have a positive skin test, or at least 80% of the time. Their x-ray is normal, their sputum test is normal. They will have a positive ELISA test though. So these are the two things that are done. If someone has a positive skin test, the next thing they do is they'll do this ELISA test, and if that's the case, they might treat you. If you have active disease, you will probably have a positive skin test. You'll definitely have an active ELISA test, and your sputum smear. They might find organisms there, and they might have a normal x-ray depending on the stage of the disease. So what about treatment? This is something that's really hard to keep track of because the standard of care for treatment for tuberculosis patients actually changes quite frequently. Generally with latent tuberculosis, it's a little bit simpler. It can be one drug, or sometimes there's a two-drug course. They'll give a person, maybe, let's say they give one person one drug for 2 months and another drug for 4 months. If somebody has active tuberculosis, you're looking at all sorts of different multi-drug therapy techniques, and treatment can last typically 6 months, but sometimes a little bit longer, particularly if there's multi-drug resistant tuberculosis, which is a scary thing indeed. So let's talk about viral infections of the respiratory system. There are many, many viral infections of the respiratory system. Of course, we're dealing with a pandemic right now of a respiratory virus, and you've probably heard lots of information about these. They're usually spread by respiratory droplets, and so that's why we have the 2 meters of social distancing, because most respiratory droplets only travel about 1 meter when somebody sneezes or coughs, and then gravity takes over and it drops to the ground. So 2 meters is giving us extra space. Sometimes people with extra big noses might sneeze maybe 1.5 meters, so just a little bit of extra space in there. And obviously direct contact with those respiratory secretions if people are sneezing and then touching things. Since these are viruses, antibiotics are not going to be effective. It would be great if we had some good antivirals against this new SARS coronavirus. I'm sure there are many groups working on that right now. So on the right here, I have the rhinovirus. Remember rhinoviruses, rhino means nose. So these are infecting the nose, sinuses, and throat areas. So all of the symptoms are usually having to do with various things going on in those sites. So we're talking about runny nose, sore throat, stuffed sinuses, those kind of things. There are probably at least 200 viruses that cause these kind of symptoms. Rhinoviruses are maybe the most common, but there are coronaviruses, there are adenoviruses, and there are a few others out there that cause these kind of symptoms. Some of them can go deeper into the chest, which can cause, obviously, more serious issues, like this new coronavirus can get into the chest and cause breathing difficulties in people. But usually the common cold, not so serious. These SARS coronaviruses, the first SARS coronavirus, that was 2002, 2003, and you can see the name, severe acute respiratory syndrome. You can see this is the big symptom we're concerned about with this new coronavirus, is shortness of breath when it gets deeper into the lungs. Probably my future lectures will have a lot more on coronaviruses. So I want to just talk a little bit about 3 different types of viruses. The common cold you can see I have here in the middle, but I want to talk about influenza here on the left, and sometimes what people call the stomach flu, which is over here on the right. So first of all, we're talking about different viruses with these kind of infections. The flu is caused by the influenza. So when people say the flu, this is what they should be talking about. But sometimes people really mean a stomach flu, which is a totally different virus and different symptoms. But generally, influenza means a respiratory type of virus. Colds, as I just mentioned, caused by all sorts of different viruses, rhinoviruses, coronaviruses, adenoviruses, and so on. And the stomach flu, usually we're talking about norovirus. Sometimes there's a few other viruses like rotavirus as well that may fall into that category. These are gastrointestinal symptoms. So let's take a look at the symptoms. Notice the flu, fever, headache, aches and chills. These are kind of the main symptoms, usually a cough. If you're looking at a cold, all those other symptoms are sometimes, and the main thing is sniffles or sneezes, sometimes a sore throat, of course. Gastrointestinal illnesses, of course, are not infecting the respiratory tract. So if you take a look on the right at the norovirus, we're looking at vomiting and diarrhea. Sometimes I call this the 2-bucket flu for that reason. Also known as the winter vomiting virus. What are the complications of these things? Respiratory infections, of course, complications are often things like pneumonia. The common cold, sometimes you're looking at, since it's not necessarily going into the lungs, you're looking at sinus infections or ear infections. Norovirus, the biggest issue is, of course, dehydration if you're vomiting and having diarrhea all the time. The other big difference with these is that influenza has a yearly vaccine. So we have a vaccine for influenza. No vaccine available for the common cold or norovirus. So let's talk a little bit about influenza. We've talked about it quite a bit this semester. Remember, influenza, of course, has this hemagglutinin and the neuraminidase. So all the influenza viruses usually have some sort of H and N designation. These are proteins on the surface of the virus that are involved in infection and release from the host cell. And they usually designate which kind of species they can infect. So humans are usually H1, 2, and 3, for example. Birds are like 5, 6 to 9 or something like that. Here's an example of a seasonal flu strain. You can see H3N3. Here's the H1N1 pandemic strain. And here's an H7N9 avian strain, avian meaning bird, of course. So I wanted to kind of top off and talk about a couple other things about the influenza virus in terms of the symptoms. So the symptoms of the influenza virus are usually short-lived, but they can be quite severe. And I want to distinguish that some of the symptoms are caused directly by the virus. So the virus will infect your nose and throat and respiratory tract, and will actually kill a bunch of those ciliated cells that are down in the chest. And so symptoms directly caused by the virus are coughing and chest discomfort. So what about all those other symptoms of the influenza virus? These symptoms are actually caused by the immune response. So fever and chills. Many diseases cause fever and chills. That's because that is the immune system trying to react and deal with some sort of infection. The immune system can also cause headaches and muscle aches. So it's your own body that's causing a lot of the symptoms when you have influenza. The chest and cough stuff, that is the virus. The other symptoms are caused by the immune response. So what's the treatment for influenza? Well, first of all, of course, we do have vaccines for the flu. Most drugs only treat the symptoms. I'll talk about the drugs in a moment. We, of course, have the annual flu shot that people can get. This is a killed viral vaccine. There's also the nasal spray flu vaccine that they market towards children. It's a little bit more expensive, maybe not as effective, and some years they don't even have it available. That is an attenuated vaccine. We do have some antiviral drugs for influenza. I had mentioned Tamiflu. There's Tamiflu there as being something that inhibits the neuraminidase, so the neuraminidase allows the virus to escape the infected cell. So I'll just finish off this unit talking about a few other, or reminding of a few other respiratory infections. So we did talk about the dimorphic fungi. Remember, dimorphic fungi exist in two forms. At room temperature, they exist as a mold, so they're fuzzy and they have all those hyphae. And then at higher temperatures, body temperature, they can grow as a yeast. So there are some pictures of some dimorphic fungi. The maybe most important one in Canada is this one here, Blastomyces. So this one here is found naturally in the environment, and I'll show you a map in a moment, in things like soil and decaying wood. Another organism that's important if you are immunocompromised is this one here, histoplasma. This one is found in the droppings of various animals, bats and birds, and it can be very, very serious if you are an AIDS patient. So here's a map of where the Blastomyces is naturally found and distributed. So you can see many places in Canada and Alberta. I think Fort McMurray is somewhere up here, so we may be okay, but of course it doesn't mean we're not at risk. So what kind of disease are we talking about? Well, this is something that's getting into people's lungs. They're inhaling it, so they're getting usually some sort of pneumonia-like symptoms or flu-like symptoms, so fevers and chills and things like this. Can be treated, can be very serious if you are immunocompromised. So there are also parasites that infect the respiratory system. So I'll bring you back to this life cycle here. Remember when we were talking about these parasitic worms, how many of them, such as Ascaris or hookworms, they get into the body, they find their way to the lungs, and then they crawl up in the back of somebody's throat to get to the digestive system. So they do go through the lungs, and in some cases they can cause pneumonia-like symptoms. So there's a hookworm. Just want to show you a hookworm. I think these things are one of the most terrifying things on the planet. So I'm not trying to scare you, but thought I'd give you a little surprise. So this is the end of part B of topic 14, infections of the human body.